cancer, doctor?
There are millions and millions of cells in the human body. The cells are actually dividing and multiplying in each second, or in fact in each microseconds. Right in the time when we are actually speaking, we are not even conscious that the cells in our body is actually multiplying. This is a very highly complex and complicated process, and it's also a very, very highly orchestrated process. If everything goes on fine, then absolutely there is not at all an issue. But if anything goes wrong, then things can actually go haphazard. So what will happen is that what determines the cell division is that there is something called as, inside each cell we have these genes, and inside these genes we have this DNA. So it is actually when the cell is dividing, the DNA will be split into two. All this process is actually happening inside our body. The human body is made up in such a way that there are checks and counter checks are there to prevent any unexpected events from happening. So what will happen in the cancer is that if things are actually going wrong, what will happen is that the body has got its own defense mechanism to correct the defect, or there is something that if the body is not able to correct the defect, then what the body does is that body will destroy those cells. But if by some process, if the body is not able to destroy the cells, the abnormality in the DNA that tends to get carried into the subsequent cells, and those cells will be multiplying with abnormal DNAs. So these cells which are having this abnormal DNAs, they in fact can lead to cancer. But this one, what we mean is that each and every cell in the human body, it's actually it has got its own potential to become a cancer cell. But the human body, the nature has made up our human body in such a way that the defense mechanisms are also there inside the body. So whenever there is a tendency for the normal cell to deviate from what is been defined as normal, the body will be destroying those cells.
Okay, is cancer a single disease?
Cancer, for a common man, it's a single disease, but for a treating oncologist like me, it is not at all a single disease. It consists of different diseases. So it's actually, we call it as a cluster of diseases. So what do you mean is that in cancer we'll be having something called as carcinomas, or the leukemias, or the lymphomas, or the myelomas, or the melanomas, are there, and that's multiple types are there. And each type there will be different small subtypes are also there. But for as I told you earlier, for a common man it is just a single disease, but for an oncologist it's a different disease, and each malignancy, each cancer needs to be treated in a different way.
Okay, the cancer has many stages, right? Can you just explain the stages?
By stages, what we mean is that we actually mean that we quantify the amount of disease what the patient is having. Okay. That's what we actually mean by staging. From a medical point of view, we classify diseases as 4 stages: stage 1, 2, 3, and 4. And for some rare malignancies, not for rare malignancies, some pediatric malignancies like kidney tumors, what we call as nephroblastomas, or pediatric tumors like neuroblastomas, we even call it as 4 stages. There are 5 stages are there. By 5 stages means like when both the organs are affected. For example, if both the kidneys are affected in a child, we call it as having a stage 5 disease. Or if the adrenal glands, both the adrenal glands is affected in neuroblastoma, we call it as a stage 5 neuroblastoma. But in an adult patient, when we are speaking, there are practically we are actually having 4 stages. But to be very practical, when you want to make it a very practical way, we classify it into 3 different. There's a different way to classify it. We can call it as a localized disease, a locally advanced disease, or in fact an advanced disease. By localized disease, what we mean is that the cancer will be confined to the organ from which it is actually found. The best example to say it is about breast cancer. If the cancer is confined to the breast alone, then we call it as a localized disease. By locally advanced disease, the cancer will spread from the organ to the adjacent areas. The same way, if you're speaking about breast, the cancer will spread from the breast to the adjacent axillary lymph nodes. And that's what then comes the advanced stage. In advanced stage, the cancer spreads from the organ of origin to other parts of the body. So if we're speaking about breast cancer, if the cancer originates from breast, and if it spreads to other parts like lungs, liver, brain, or bone, we call it as an advanced stage. Okay. So practically we can call it as a localized disease, a locally advanced disease, and an advanced disease.
Okay. And what are its symptoms?
The symptoms for cancer, when we are speaking, can be very, very non-specific. That's a problem with cancer also. See, the symptoms depends upon from which organ the cancer is actually originating. As I mentioned earlier, each and every cell in the human body has got the potential to get converted into the cancer. Same way, the cancer can actually develop in each and every organ of the body. It can start. There can be cancer of the brain. There can be cancer of the heart. There can be cancer of the lungs. There can be cancer of the brain, of the blood. There can be cancer of practically any organ in the human body. I mentioned about heart cancers. Heart cancers are very, very rare, but in fact it can also occur very, very rarely. It may be once in a lifetime for a practicing oncologist, but it can actually originate. So the symptoms depends upon from which organ the cancer is actually originating. So when we are speaking about generally, we can say that some symptoms are there which we can actually say that which could be the symptom of malignancy. One is like any persistent lump in the body, any swelling which is persisting in the body for a quite long time, which is not disappearing in about 2 to 3 days, or 1 2 weeks could be a symptom of malignancy. Second one, it is unexpected bleeding. See, normally we expect bleeding from some particular sites. If we are seeing bleeding from unexpected sites or from locations when we are not actually expecting it, it could be a leg bleeding. For example, if somebody is passing blood in the blood while passing stools, it could be cancer, because this is a symptom which is not very specific to cancer, but it could be part of symptom. Third one, it could be like unexpected weight loss. If the patient without fasting or the patient is continuously losing weight, it could be part of cancer. And second one is unexplained fever. If the fever, and everybody develops fever once in a while, and usually the fever resolves within about 3 to 4 days. And if you're not able to identify the cause of fever, like that is, we are rolled out all infections, and if the patient is continues to have fever, it could be a part of malignancy. So generally, when we are speaking, we call it as these 3 symptoms: any unexpected persistent lump in the body, any unexpected bleeding from any orifices, unexplained weight loss, and unexplained loss of appetite. These are the general symptoms which we are actually taking when it was about the symptoms of cancer. But the issue with cancer, as I mentioned earlier also, is that it could be very, very non-specific. It all depends upon the organ from which it is formed. For example, if I take in the case of lung cancer, one of the most common cancer that is affecting males in our country. So what is happening in lung cancer is that the symptoms could be very non-specific. It could be continuous cough, but a good majority of the people will be having cough, or there will be bleed. But then that could be an early symptom of cough. So if any symptom is persistent for a long time, whenever people are developing any symptoms, and if we expect that the problem to get resolved in about in a couple of days or a week, but if the symptoms are persisting, it could be a part of, it could be malignancy. I'm saying that it could be malignancy, that's all.
Doctor, how do we diagnose cancer?
So first, when we are having that suspicion of malignancy, then the patient needs to be worked up. We need to diagnose this disease. It all depends upon which organ the malignancy is we are suspecting. The most common thing, as I mentioned about, could be a breast cancer, because that is the most common malignancy which is seen in our country among females. So the patient will present, the ladies, they will usually present with a lump in the breast. But by lump, what we mean is that they can present with a swelling in the breast. So what we are doing is that we are supposed to do a biopsy of that lesion. So biopsy of the lesion means like we'll be taking a small piece from that abnormal area, and that will be subjected to other testing. So by doing this all investigations, we'll be able to conclude, we will be able to diagnose this disease.
And how does the treatment go for such cancer?
So once we diagnose the disease, the next important thing is that we have to stage the disease. By staging, what we mean is that we have to find out the extent of disease. As I mentioned earlier, there are 4 stages, are the stage 1, 2, 3, and 4. So first and foremost thing is that we have to diagnose the disease, and once we have diagnosed, then the second important thing is that we have to stage the disease, because treatment depends upon the stage of the disease. So if it is a localized disease, we are speaking in terms of a curable option, so we are speaking in terms of a curative lesion. If it is a locally advanced disease, that means where the cancer has spread from the affected organ to the adjacent areas, it is potentially curable in that situation. But if the disease has spread to the other parts of the body, if advanced stage, then we are not speaking in terms of a cure, but we are speaking in terms of palliating. By palliation, what we mean is that our aim is to keep the disease under control, but not to cure the disease. So it depends upon the treatment, depends upon the stage of the disease. So it varies from malignancy to malignancy. For example, if you're dealing with a breast cancer, the treatment will be different. If you're dealing with a lung cancer, the treatment will be different. But generally, the principles in oncology will remain the same. Either it is way to first find out whether the patient is having a curative intent, or the patient is, we are planning to go for the patient for a palliative intent treatment.
And what do you mean by the screening of cancer?
It is a process that begins with a particular investigation, and then it has to be continued until and unless a particular disease has been ruled out. So that is actually the definition of screening. The problem with screening is that it needs to be started at a particular age, and it needs to be continued in the way it has been prescribed, and it has to be continued till a particular age. Then only the screening will be complete. So it is a process by which we are actually looking out for malignancy. Rather than normally what will happen, the patients will come out with the malignancy. So screening is a process by which we are trying to find out whether the patient has got the malignancy in an early stage. So we are doing some investigations to find out that thing. Practically there are only 2 screening tests are available right now. Even though people are speaking about multiple options, but then we are actually speaking about 2 tests are only. One is in breast cancer, where we do something called as a mammography, mammogram, and second one in cervical cancer we'll be doing something called as a pap smear. But other blood tests like PSA, all these things are there, but it is associated with its own controversy, so people are traditionally not following it nowadays. People used to do it, but nowadays we are not following it. So right now we have screening applicable for 2 malignancies, that both in females, one for breast cancer when we do as a mammographic examination, and second one is a cervical cancer for which we are doing what is called as a pap smear examination.